My name is Irene Achieng Opio. I am a community health volunteer attached to Babadogo Health Center. I volunteer for wasichana wetu wa faulu in Nairobi. My work as a community health volunteer is to visit the girls. I'm a link or maybe a bridge, because I link these girls and their families to school. I also do the linking in hospitals, maybe when they are sick or when they need any medical help, any medical assistance. I also link them to maybe chiefs, this administration when they need help, because we also not we don't mainly focus a lot. We do focus a lot on girl child, yes, but as a volunteer we come across other children who needs our help. Maybe it could be boys, but our main focus is the girls. During this time of pandemic, our girls are facing a lot of challenges. Number one, during the pandemic, a lot of parents lost their livelihoods, meaning they don't have meals the way they had to, because they lost their jobs during that time. So when you visit that household, you find that the family maybe doesn't have food, the family lacks food. So me as a community health volunteer, I have to chip in back to my pockets, because I cannot leave them like that. They need to eat. And for a girl or the household, leave alone the girl, the whole children, minus eating, you don't expect the kids to study. For somebody to study and even understand whatever they are reading, they have to have a full stomach. The second challenge is the distance. Some of these parents live far, and I must do the household visit, because I need to monitor the kids, the girls, the way they are doing during this pandemic. So I always find myself walking a long distance from the place I'm living to where I am supposed to go do the household visit. I also need to call them prior to my household visit, because you need to know they are at home in case you walk to that place and you don't find them. And the airtime, the credit is something that we lack at times. So we need to walk, we need to call them. So I find myself spending a lot for me to make my household visit. In the case of the girls who are left at home alone with nobody to guide them, as a CHV, I'm forced to guide them. Something that I'm not a counselor, I've not been trained as a counselor, but I just guide them the way I can. And also the parents, some of them you find that they call us so that we can sit down, have a sit down with their kids, because maybe they see that their children have overgrown, the kids no longer respect them. So you are called in, because I'm the only person who visits that household. So they tend to trust me more. So when I go there, that is the thing I do, I counsel them. But the challenge is that I'm not a counselor. So some of these things, I just guide them the way I can. There is also another challenge about these households we visit. We have parents, maybe even the girls or any member of the family who lives with a disability. It's really a heartbreaking scene. Some of these things we see them pass through, we cannot unsee them, we cannot undo them. So it takes a lot of time for them to find help, meaning I need to spend a lot of time to make sure that these people get help that they need. This place is like a slum. So you find that we have girls, like in a class, like a good percentage of the classroom is of vulnerable children. So when we are given bursaries, this bursary is like a drop in the ocean. So as a CHV, for me, the bursary issue, it has been stressful. Being a CHV, I tell you, it's the hardest job to do, especially in the areas I come from. It's the hardest, because I cannot help myself, I cannot do it. Some parents think and they know we've been given money, of which we have not been given money. I'm a CHV, community health volunteer, meaning I'm a volunteer. So I'm not given any money, I'm not being paid. So when you go to these households for the visits, it's like they are aggressive. They ask, we are eating their money. They don't see that money trickling down to their families. I had an issue with a parent who refused me to visit her daughter because she told me that since I started visiting her, she's not seen any money, she's not seen anything good. She's not seen me take anything good to her house. So it was a big challenge. I tried explaining it to her that we are not being paid. It's just a passion. It's just I'm just a volunteer, just trying to see how the girl is going, monitor her, and help her in all the ways that I can. So it has been a challenge. We are not being paid, but the parents see that we are eating their money, of which is not true. So in conclusion, I'll still go back to the bursary reforms. I only wish these bursary reforms could be more than the ones we are being given now. And I also wish that even the boy child will also be considered, because some of them also are also vulnerable. Some of them pass with good marks and they cannot go to Form 1 because the parents are not able to take them to the next transition level. Back to the girls, I wish you could add some more help to help them even more. Being a CHV, I'll still reiterate, it's the hardest job around. I just do it out of passion because I love my community. I love the people from my community, and I wish you could move along and nobody to be left behind, especially in education. Thank you.